So I'll just quickly introduce us. So I'm Helen Bainon, Richard McCormack, Sarah Cadell, and we're all from the Greater Manchester Screening and Immunisation team. Coming today just to do a quick update on COVID and flu vaccinations and a bit of a cold chain. We have got a few slides, so what I suggest, Sarah, is we whiz through them as quickly as we can, so that we give people a chance to ask any questions that they wanted to ask in this session. So, Richard, are you okay to bring the slides up, please? Thank you. So I think, Sarah, you're a little bit on flu first.
Yeah. So it's just a reminder that this is the flu vaccines for this year, and it's sort of helpfully sectioned out into the different ones that are available and should be used for each of the different cohorts of people. So it was just a quick reminder of that. I mean, it is available, and I've put the link to that in case you do need it on the actual presentation. And it's showing for the 6 months to 2 years, the 2 years to 18 years, the little V that's on there is saying that those are available through Inform for the children, so that they're free ones, they're not the ones that you have to buy for the practice. So that was just the reminder of the ones that you can do, and it just tells you they're ones that we're going to be giving. But I did want to mention something about the egg content of the vaccines. So we get an awful lot of queries into our enquiry line about egg allergy and flu vaccines. So on here, it was just to remind that you want to give, there are ones that are egg free or have a very low of albumin content, and they can be safely used with people who've got an egg allergy. LAIV did have a higher level than it has now, but even that was said to be safe for children who just were allergic to eggs. But now it's even less now that's actually included in that. The exception to this, though, is children who've required admission to intensive care for a previous anaphylaxis to egg. So these children, it's not safe to give the LAIV to, and they'd need to be given that in hospital. But children over 2 can be given QIVC because that's got no egg in it at all. And if you gave it to a child under 2, it's not licensed, so that would have to be given off-label. Adult patients, it's just a reminder that they can be offered egg-free vaccines, and the recommended ones are the QIVC and QIVR. And this includes the over 65s as well, because AQIV is not suitable for any person over 65 who's got an egg allergy or has an anaphylaxis to egg. And I just want to remind everybody as well that QIVE is not a suitable vaccine to be given to anybody who's over 65. We have had quite a few incidences of this where this has happened, and we're just having a bit of a look into what the reasons behind that, if that's a recording error or it is actually that people have been given the wrong vaccine. But please don't give QIVE to over 65s, it's just not suitable. There is a table there that shows you the egg content or the ovalbumin content of the different vaccines, just in case you need a reminder, and the links to the Green Book chapter 19 are showing there, and also that link to the table if you want to double check what the egg content is in the vaccines. And I just wanted to show uptake as well. So this is week 42, so this is last week or even the week before. We've not got the most up-to-date information yet, it's still waiting, but this table shows the red bits are where you're below, or where the locality is below the GM average, but at the side of that number is whether you're higher or lower than you were last year, indicated by the arrows. So it was just a chance for you to have a look at where you are. So there is quite a lot of green on there, especially with the over 65s. People are doing better in the over 65s, but then we can see in certain areas that is falling compared to last year as well. The under 65 at risk, we are seeing quite a few more areas there that are lower than they were last year. And the 2 and 3 year olds, there's nobody. Oh no, there's one. Berry is higher than they were last year for the 3 year olds, but everybody else is lower in that. So it's just something to be aware of. And if you're a practice nurse in a practice that's doing well, then thank you very much. But it's just, we haven't done it by practice. Obviously, we don't want to name and shame anybody at all, because we want to give praise to the people who are doing really well. And I know it's really hard at this time of year to get the 2s and 3s in. And I don't know whether the parents are wanting 2s and 3s to be vaccinated. I'm seeing or hearing about a lot of resistance from parents saying that they don't want their kids to be vaccinated. I'm not sure why, but we are seeing a reluctance of parents. And the graphs below just show it pictorially, the information above. So on the left hand side, the under 65 at risk, I've just highlighted these. The GM and the 2022-23, or the averages were the same. And then you can see on the right hand side the 2s and 3s. It just shows you where there's nobody. I can't see anybody who's doing better than they were, or apart from that's a combination of the 2s and 3s, so it doesn't show that the berry one, but it is only a slight increase there. But yeah, I know people have been holding parties for 2 year olds, the 2 and 3 year olds, and for the Halloween and different things. And we used to have the grab a jab type things, didn't we, to hold have the parties and things like that. And COVID put paid to all of that. So we've not had the sort of appetite from the public to come into GP practices to get children vaccinated. I'm not sure whether it's that they don't want to bring them in, or they just don't want the kids vaccinated. Just any feedback you've got onto that we'll take, because we are interested to know. Thank you.
I'm just going to have just go through the COVID-19 vaccines, a bit of a change of tack from Flo. Just looking at who can get the vaccines, and also just the types of vaccines that we've got at the moment in this phase 5. Everyone aged 5 or above on or before the 31st of August can get the first and second dose of the vaccine. That's the evergreen offer that's continuing for the moment. People aged 16 and over, and some children aged 12 to 15 can also get a booster. And then certain people, including those 50 plus, high risk individuals due to medical history, pregnant women and frontline health and social care workers are offered seasonal boosters, as in the autumn booster that we've got going on at the moment. Our 2 main types of vaccines are the Moderna and the Pfizer vaccine, also known as Spikevax and Comirnaty. There is a third vaccine, Nuvaxovid, which we don't see as much of, but I'll explain that in a sec. So there are a number of iterations of these vaccinations now as well. So we started off with the primary vaccine, the Spikevax, 100 micrograms in 0.5 mils. With Moderna, and then they halved that for the original booster that we gave post the evergreen offer, and that was 50 micrograms in 0.2 mils. And Moderna have now brought the bivalent booster out, which is 25 micrograms of the original Moderna with 25 micrograms of a new Omicron version, and that's in 0.5 mils. Pfizer and Comirnaty have got 4 versions of their vaccine now. Their primary vaccination, the initial one that they brought out, which is for people aged 12 plus, 30 micrograms in 0.3 mils, and that's called Comirnaty 30. We've got the children's dose, which is the 10 micrograms, Comirnaty 10. The original booster, which didn't have any adjustments to it, it was just the straightforward single dose of the 30 micrograms in 0.3 mils. And they also have a bivalent booster for this autumn campaign, which is a 15 of the original and a 15 of the Omicron version in 0.3 mils. Nuvaxovid is for those patients, and quite rare, but there are patients who are anaphylactically allergic to mRNA vaccines, which both Moderna and Pfizer are. And so the Nuvaxovid gives us an alternative. These will be run from hospital hubs, won't be in primary care. They'll be in designated hospital hubs, and in Manchester that'll be MFT and Salford Royal. And this depends on a referral from a GP, where people are assessed to see whether they're clinically suitable for the Nuvaxovid vaccine. I just thought we'd put a slide in for PGDs and national protocols, probably speaking to the experts here really, but I think I just wanted to sort of try and simplify the difference between these two, the PGD and the national protocol, and so try to put it in these sort of terms which sort of make sense in my head anyway. So obviously we've been using national protocols for mainly during the COVID-19 vaccination campaign, which has probably been more applicable to a large vaccination programme which needs to be done at pace. So a PGD is a set of written instructions for the administration of medicines to groups of patients who may not be individually identified before presentation for treatment. And that's where they're both very similar in that respect, but the difference is that tasks cannot be split in a PGD and they must be delivered by a registered practitioner. Whereas within the national protocol, we can split tasks where we can have registered and non-registered practitioners. Registered practitioners to take consent and assess the patient, and non-registered practitioners to draw up and administer vaccines and post-vaccine observation as well. I know we've had quite a few questions through with that, and there's a lot more to it, but we just want to put that in just to try and simplify that. And yeah, feel free to ask any questions. I just also wanted to present a little bit of data on the COVID data from 2 days ago, and this is just some numbers across GM. So we've got a total eligible population GM of around 1.268720 people. We have vaccinated 532,277, and this is the breakdown of the areas here. The red areas being ones that are just under the average, and the rest are over the average for the Greater Manchester total. This is the Northwest total here as well. So as an area, we're just slightly below the Northwest total, and that's just in pictorial form here in the bar graph, with the Northwest average line here and the Greater Manchester average line here. Yeah, hopefully that's helpful, and I will hand on to you now, Helen.
So I'm just going to talk very, very quickly because I'm conscious we've got about 2 minutes probably. So just wanted to just do a very quick reminder of some of the basics, but just to touch on these again for quoting, because we had again several reported incidents to us this year around vaccines not being put in the fridge. So I don't know if someone could go on mute. There's quite a lot of background noise. Is she feeling well today?
Yeah, she has been. That's why I've only brought today.
I don't know if anyone else on the call will be able to just mute. I'm conscious I'm not sure what conversation we're hearing there. But just want to remind everyone about the importance of using data loggers. Data loggers are an incredibly helpful tool when there has been a cold chain breach with the fridge. It can help us really pinpoint whether these vaccines can still be used or not. So we do recommend that wherever there's a vaccine fridge, there is a data logger in use in that fridge as well. It needs to be set to record at regular temperature intervals, really every 10 minutes, because that's going to give us the best information around how long a breach has lasted for. And just some general reminders, please make sure if you have got a data logger that it's not run out of battery, the memory hasn't become full, and it's checked at least once a week, because we've had several incidents where practices have had a data logger, they've had a cold chain incident and then the data logger just hasn't been working, so it may as well have not 100 in the fridge. Thank you. And just general reminders about the principles that there. So making sure the temperatures are recorded at least once a day, that they're documented, that the fridge has been serviced annually. Everyone in the practice has responsibility for monitoring, should know what to do if the temperature is out of range. And please make sure that everyone in the practice is aware of what to do with vaccine deliveries. We've had quite a lot of fluens lost again this year due to not being put in the fridge when it's received. And I think we're going in 10 seconds. So that was a whistle stop time.